and thank you for making Unity Health's second online product launch a reality. My name is Weza Matomane. You can call me Weza That Guy. Today, I will be channeling the expertise of some of our panelists right here. We've got 4 panelists who've got so much knowledge to answer all your burning questions. Today, I want to encourage you to also be part of the conversation. Make sure that you are indeed part of this by using our live chat functionality. Simply type in your questions or comments and we will be notified of them. And a little bit later on in the program, we'll try to answer those questions as well. Now, if we don't get to answering everyone's questions, don't worry. We will actually make a podcast available after the launch and we'll be able to address some of the questions that we didn't get to answer. Alternatively, you can also email your questions to qa@unityhealth.co.za. What's more, just by staying online, you could be one of 10 people to receive a Take a Lot voucher worth 750 Rand. Okay, so let's meet the gurus. First of all, I've got CEO of Unity Health and the de facto product owner for Unity Health, the insurer being Constantia Insurance. Vernon is an actuary with more than 25 years experience in the insurance industry. Welcome, Vernon.
Hi, thanks, Weza. It's nice to be back here again and excited to talk to you guys about the products for 2021. And the theme for next year, of course, and going into next year is stay healthy. Hashtag stay healthy.
Very true indeed. Let's talk about that theme. How are you staying healthy?
Well, you know, Weza, every day I wake up in the morning, I do about 1 to 2 hours of yoga and meditation, and that really helps a lot.
1 to 2 hours. Wow, you must be a master by now.
Not quite a master, but it certainly helps a lot to keep my balance and sanity.
Awesome stuff indeed. Well, next to Vernon is Arnold. He's the business development manager, and you spend quite a lot of time on the road, and you visiting brokers each and every year. How's that been?
Hi, Weza. Thank you very much for seeing me again. We've had an interesting year, not being able to get to see guys at the moment. But there's a lot of interest out there. So I'll be chatting about the effects of COVID-19 on our brokers.
Well, I know that brokers are an integral part of the business, so I know that this is certainly going to be quite a valuable discussion that we will have. Tell me, how do you stay healthy?
Weza, I try to keep myself healthy by eating correctly, but unfortunately I have a bit of a penchant for chocolates. So it's a bit difficult at times, but at least my children keep me healthy by eating all the chocolate I hide away from them.
I mean, chocolate is such a great delight, and it's just one of those things that you just can't get rid of. Like, you can try to be vegan or try to be this or try to be that, but chocolate's got to feature somewhere, right?
Chocolate always.
Well, moving on, I also have here Michael Emery. Now, Michael, you've been in many different industries. First at ER24, you moved over into Mediclinic before joining Ambledown, and that gives you about almost 14 years or a little bit more than that experience within this space. How are you doing today, and what are we going to be focusing on?
Hey, Weza, great to be back, and we're going to be talking really about 2 things. One, how we can support our brokers during this COVID-19 pandemic, and the second one is enhancements and service delivery improvements. We just want to talk about those and how we're going to help our members interact better with us.
Now, Michael, the other part of what I know about your character and just your persona is that you're always so calm. I mean, you are the opposite of Mr. Panic Mechanic. So tell us, how do you stay relaxed during this time, especially now, COVID-19 and the lockdown?
You know, it's been really busy and every day seems to just follow the next one. But what's really helped me is I've become like Arnold, secretly addicted, but not chocolate, Netflix. So to crush a whole series in an afternoon is what a pleasure.
That's pretty cool. Always nice to know that Michael always comes here with a trick or two up his sleeve. So I'm actually quite excited to hear what he'll be announcing a little bit later on. Now, faced with the reality of COVID-19 and unable to join us here in Johannesburg, she's joining us now live from Cape Town. It is someone who is a part-time academic and also an actuary. She's the CEO of Percept, and it is Shivani Ranchard. Hello, Shivani.
Hi, it's great to join you from here. It's one of the perks of the travel ban. I get to work from home.
Shivani, it sounds like you're a little too happy to be working from home. Are you a homebody?
Yes, I am. I especially love being in the kitchen, and I do especially love cake.
Now, I love surprises, so I'm going to keep you in a little bit of suspense because we've got a special guest that we're going to be introducing to you a little bit later on. So stay tuned. Now, gentlemen, we can't help not talk about COVID-19. I mean, it's facing many people all over the world, and it's certainly something that is quite important. I want to know from you, how have you and your families maybe been coping and dealing with the lockdown and the COVID-19 pandemic? Michael, let's start with you.
Yeah, Weza, initially it wasn't too much of a problem, having spent a number of years traveling for work. So to work from home wasn't really a real challenge. However, my wife ended up getting stranded in Dubai. So from late March and through the whole of April, she was stuck in Dubai, when we obviously fortunately managed to get her back to South Africa through a flight arranged by the Department of International Relations. Since then, we've been all squirreled away back at our home. But it's been like that movie Groundhog Day. Every day has seemed like the same. And now we're here towards the end of August. Hard to believe.
Shoo, that sounds hectic. I'm glad everything has finally settled down. How about you, Shivani?
Well, as I said earlier, I bake cake and I eat it too. But on a more serious note, I've enjoyed being more intimate with my home, using spaces that were previously neglected, for example. Always amazed by how you see new things even when you're in the same place.
Yes, I think it is definitely important to be thankful in times like these. Arnold, how did you do it?
Yeah, it's more of a horror story. I'm lucky. I have a wicked sense of humor, so I find something to laugh about every day, and that keeps me sane.
And I'm sure the chocolate has something to do with it as well.
Oh yes, yeah.
My goodness. How about you, Vernon? How's it been for you?
Well, I just try to stick to a routine, take breaks when you need to take some breaks. Also Netflix, as Michael mentioned, I think Netflix has got a lot more viewers these days.
Wow, guys, I'm guessing these are the stories we'll be telling our grandchildren one day. Now, you guys have told me a lot about how you are dealing with, the lockdown and the pandemic. Michael, can you please come in and tell us, how has the company been dealing with the pandemic?
Sure, Weza. Fortunately, we work with a lot of smart people, Vernon being one of them, and our executive team took a decision to implement a work from home strategy before the lockdown ensued. So we were well prepared, and we had a smooth transition to having operations as normal, but having everybody work remotely.
That's actually quite true. I mean, it's so important, to be flexible, to be adaptable, and to be responsive in this time. Vernon, can you please elaborate here, especially around, people having to work from home? What does the strategy mean?
Well, we've worked quite hard over the last few years putting together all these operational processes that we have in place. So it was quite easy for us just to get a few laptops, get a few Wi-Fi connections, and have everybody working from home in about a week, since from the announcement of the president.
Now, Shivani, I'd like to rope you in on this one. When we look at the bigger picture, can you give us a general overview as to the state of primary care during the pandemic?
So to give you the global picture first, countries that have coped best with COVID-19 leveraged their primary care systems. Germany is a great example of this. By delivering services to people's homes, they minimized the spread of infection in facilities so they could continue their primary care. They, of course, also did a lot of testing. But in the South African public system, unfortunately, we've seen a huge drop-off in access to primary care. Family planning, vaccinations, TB screening, etc. What this says is that we have to take our cue from countries like Germany and reimagine how our primary care services are delivered.
Thanks, Shivani. I guess it's easier said than done in a country like South Africa from an infrastructure, political, and maybe even economical perspective. Now, Arnold, let's talk about the reality that brokers are facing. I know that there were a lot of challenges maybe that brokers could be facing around the pandemic and how they've been doing their business.
Definitely was a. The biggest problem facing brokers is growth. They have an industry a business that runs. They have income coming in monthly. But obviously, every company needs to see growth. And with COVID coming in, people are too scared to take out new products. So the growth has been very, very stagnant this year. And that's been their biggest challenge.
So you've heard what our experts here have had to say about all of the challenges surrounding their lives, and as well as how the business is coping as well. But it's interesting to know exactly what's happening on the front line. So now we cross over to Dr. Robin Holgate. She is the Chief Medical Officer of ER24, and we hear what she has to say about the front line.
COVID-19 has fundamentally changed the way we deliver care for our patients. We still need to care for and be available for any emergency, but COVID-19 has stretched us to new levels of coping, physically, clinically, and emotionally. Since the start of the pandemic, we've seen a big increase in calls related to COVID-19. Initially, there was panic around international travel and whether patients should be tested. What's very concerning is that we're now seeing people with chronic conditions who've deteriorated, who are seeking advice regarding whether they should go to hospital or not. The severity and intensity of the calls have changed as we move through the pandemic. We're seeing a lot more queries regarding whether a patient should go to hospital and many requests for ambulance dispatch. In the past, requests were mostly related to testing, where the testing stations were located and whether the patient should indeed go for testing. And like all clinical conditions, we see a spectrum of disease. However, we're now seeing a lot more patients with acute respiratory illness who are hypoxic and ill, and in keeping with the clinical presentation of coronavirus disease. A lot more of these cases require hospitalization. So yes, the tone has certainly changed over the past few months. There's been a noticeable increase in medical calls during the COVID-19 pandemic. This has been offset against a decline in trauma-related calls, although we did see a big increase in trauma-related calls during the brief relaxation of alcohol sales. Absolutely. There's no doubt that the alcohol ban has had a significant effect on the amount of trauma-related cases we've seen. Road traffic and domestic accidents have declined since the reintroduction of the alcohol ban. This has allowed us to focus on our medical patient load. We usually experience an increase in hospital diversions during the winter months, and there's times when the capacity within our hospitals is exhausted. But our experience has been that the majority of our emergency centres always endeavour to assist with critical patients, even if bed availability is stretched. It's incredible how teams, whether from the state or the private sector, have all been working together in the best interest of our patients. I'm constantly in awe of the passion and resilience from the frontline medical teams.
Wow, Vernon, that's certainly an eye-opener. It never ceases to amaze me how every part of the healthcare system contributes to the overall health and, of course, the functionality of our country.
Absolutely, Weza. It's been a very challenging time for our healthcare professionals in this country and everywhere around the world, in fact. And we should actually say thank you to all the emergency service personnel, healthcare practitioners, etc., for doing such a great job in this country, putting their lives on the line, putting the lives of their families on the line, and helping our members. We have a lot of healthcare practitioners that have tuned in today, so we want to say thank you, everyone, and thank you very much for helping our members.
Now, remember to stay tuned because we've got a special guest who's going to be joining us a little bit later, and it suffice to say that it is also someone who's in the business of helping others. Now on to the topic of healthcare and difficult circumstances. Shivani, if the government doesn't make any definitive announcements, how would the NHI impact healthcare going forward?
My biggest concern is that the uncertainty and the big bang nature of the reforms will mean that we actually end up not reforming our healthcare system, while there are a myriad of things we could do to improve the lived experience of all South Africans.
Absolutely. So what would you say government can do to improve primary healthcare?
So many things. I'd say at the top of the list are that we need clear regulation that enables pre-funded and pooled access to private primary healthcare. We need regulatory reform to support telehealth and multidisciplinary teams. And the medical scheme benefit package needs to be reformed to incorporate both primary and palliative care. And that's just a few critical areas I believe should be addressed urgently.
Now, Vernon, there's been quite a lot of talks on the news around NHI and it being escalated. I mean, that's all we've been seeing for the last couple of weeks. You being on the Health Advisory Committee, do you have a little bit of updates here, especially seeing as we all know what the Council for Medical Schemes Circular 80 has been saying?
Thanks, Reza. Yeah, we've had some meetings with the Council for Medical Schemes and they've all been fairly promising. So we will be putting together this low-cost benefit framework pretty soon, and that will be released in the foreseeable future. And one thing that the registrar has assured us is that no one will actually have a gap in coverage going forward.
That's actually quite reassuring to hear. And let's talk about how did COVID-19 impact the product offering of Unity Health, and has it had any influence on membership?
Well, our key focus was obviously taking care of our membership. And so we realized that there were going to be a lot of questions that members would be asking. So we prepared our case managers to take calls, to answer questions of our members, whether they're positive, whether they think they might be positive, and guide them through the process of either getting tested or going into quarantine, etc. So we've also released a lot of communications going out in terms of practicing good hygiene, staying healthy, social distancing, etc. And there's also been people have taken strain over this period. So there's been a lot of there's been increased volumes to our counselling services, and we've also extended our counselling services to include Skype sessions as well. So a lot of people are just struggling, maybe being at home, whatever the situation might be, and they need to phone in for some assistance. We've also helped membership that want to join, so new members joining. We've waived the waiting periods so they can access benefits straight away. Companies that are struggling, we've offered them premium relief arrangements so that they can defer their premium payments into the future, but their members will still be able to access benefits straight away.
Wow, that is a very empathetic as well as a responsible response to the challenges. I think they'll really appreciate all of those measures that you've put in place. Arnold, I want to rope you in here. Let's talk about COVID-19 and especially now the challenges that brokers have been facing because of it.
Well, so the biggest problem is uncertainty. How do you prepare for the unknown? So brokers have been trying to start bringing new members on board, and all of a sudden you have something where they ban the alcohol industry. So should a broker have been busy with someone in that industry, they might have been close to signing up a deal. All of a sudden the guys are saying, sorry, we can't carry on at the moment. So the uncertainty has brought around a huge problem with them. But that being said, the companies that are still on board have stayed on board. And that shows that they're looking after their people and making sure that their people are covered at this time.
This is actually quite important that, people are actually feeling like, okay, there is a lot of uncertainty, but there's some ways in which we can still stabilize the ship. Now, how have you been keeping in contact with people, especially with brokers, within this lockdown period?
Like everybody else, we've been using Zoom meetings and Skype meetings as well as Teams meetings. A lot of phone calls going on between each other. But the biggest thing has been the brokers have been able to stay in contact with us through our call center, through our network division, through our claims division. And those guys have really been amazing in the background, helping them out and keeping business as usual.
I hear that the big word out there has been, your mic is muted.
The statement of 2020.
Yeah, Michael, how have we done in making sure that our brokers and clients are kept in the loop, and we of course addressing some of their issues and even some of their queries as well?
We've got a process. We've got a couple of processes that deal with that. First of all, we've got a team of business development managers and broker consultants, and they interact with the clients and members as and when required. We also have a composite set of frequently asked questions and answers, which is vested on our website. The members and brokers can access that. We obviously also have the normal marketing material that's got all the product information, so if people need to read up on what the product is. And then, as we've alluded to a couple of times, we're going to be unveiling our newest team member who's focused on service delivery, and they are going to take care of those things that we can't.
That's pretty good, Michael. Can you also share with us some marketing advice for our brokers around Unity Health's products?
Yeah, I mean, Weza, we really believe that Unity Health is really relevant at the moment. And the reason for that is we provide access to primary health care. It's what the people need in South Africa. And I mean, just taking COVID into consideration, we've been able to work in a COVID test, paying for the COVID test for members who test positive into our benefits for 2020 without raising any prices. So, I mean, our brand is strong. We've got a great story to tell. And as Vernon mentioned, our focus for 2021 is stay healthy.
You've been giving us a couple of throw forwards around, some exciting things in the tech space. Can you please elaborate?
Yeah, sure. Just first of all, in terms of our app, we've made some development on our Unity Health app this year, and we've included some additional functionality. First is benefit limits, so members can go and look at the benefit limits online. The second is, which Vernon mentioned, is the news portal. So all of that communication around how to stay healthy and all of those things are available for members through the app. We've also put in a please call me functionality. So if some member runs out of airtime, they can send through a message and we'll call them back. And then last but not least, we've got a survey to test our service available through the app so that we can keep ourselves on point. Members can fill in their experience right after using our service.
Well, speaking of innovation, it's now time for us to introduce to you our special guest. It's that moment that we've been waiting for. Michael, would you do the honors?
Yeah, thanks, Weza. I mean, we're in an era of digital transformation, and what we decided to come up with is we are today launching Unibot, which is our online chatbot that will be operating from this afternoon, 27 August, on the web, and it will take care of a lot of the questions that members will have seamlessly. The reason for that is that we believe that members engage with us online and we'll have a seamless process to improve service delivery.
Well, if you are wondering how seamless this is all going to be and how amazing Unibot is, the good news is that I managed to get a couple of people together and have a little sneak preview of Unibot. I got to test him out, and guess what? He's absolutely amazing. If you don't believe me, check this out. So you'll find Unibot right here at the bottom right-hand corner. Let's get started. Hello, Unibot. Okay, let's say I am a new person that just wants to sign up. I'll just simply press here, and then all I need to do is click on the link and fill in my details. It'll capture my details and the communication will go from there. In my case, let's say I am already a member and I'll select that instead, and I want a claim inquiry. Now it will ask me a few questions like my name, and I'll just fill that in. Weza. And now it is my cell phone number. Okay, let's say 22222. After that, it will simply just ask me for an email address. I'll skip that for now. And as easy as that, everything is done. Anything else? I'll say no. Oh, thanks. Have a great day too. Let's get started again. This time around, I'm going to say I'm a broker. And what am I looking for? Forms or brochures? I'll ask for a brochure. And then it'll ask, okay, group or individual? Let's say group. Cool. And now all it needs to do is ask a few more questions and I can get that exact attachment that I'm looking for. Oh my goodness, this is so convenient. That's why I'm telling you that this right here is a new staff member of Unity Health. Let's go on, and this time around go back to the main menu, and I'm going to say I am a network provider. Now what am I looking for in this case? I'll say I'm requesting a certain document on pathology. There's the attachment right there. And anything else I can assist with? Oh my goodness, you are so helpful, Unibot. But this time I'll say no. Nothing else you can assist me with. But let's ask you some ridiculous questions and let's see how you do. How old are you? Age is nothing but a number. Smart. Who's your boss? I work for Unity Health, the best primary care provider in the land. Nice one. Give me a hug. Oh, a virtual hug to you too. When will lockdown end? You are just so amazing. Will you marry me? Vernon, we have now talked about technological enhancements, but what about product enhancements? What does Unity Health have for us in store for 2021?
Thanks, Weza. We've actually done a lot of work on our product over the last few years, and we find that we've reached a really good balance in terms of benefits offered to members and affordability. So what we're going to be doing for next year is increasing, most of the limits are going to be increasing well in excess of medical inflation. So members will be able to have a lot more benefits next year than they have this year. So we'll also be working quite hard on enhancing our disease management programs, our communication strategies and education programs so members can access benefits a lot easier and understand how to use it in a much easier way. And obviously staying with the theme, stay healthy for 2021.
That's quite insightful, and I think a lot of our members would definitely appreciate everything that you've just mentioned. Could you now mention some of the top reasons why anyone should consider Unity Health?
Yeah, thanks, Weza. So I think we got one of the best products in the market in terms of benefits being offered and in terms of affordability. We have a great app that's accessible to all members so they can access their membership information, claims information, benefits information. They can do a please call me back. They can have a push-to-call emergency function to call emergency services. There's also a lookup function. If they want to find a provider in the area, they can look that up as part of the app. We've also been growing quite significantly over the last few years. So we've seen this growth is obviously a reflection of members really enjoying our benefits and feeling that it's a good company to be with. So we're quite happy with where we are now.
Wow, that's quite an achievement. It looks like Unity Health certainly has a bright future, COVID-19 or no COVID-19. Tell us, what does the future look like? How is the evolution happening from 2021 going forward?
Thanks, Reza. So we certainly have a digital strategy at play, and we're going through this whole digital transformation. In fact, we have been going through it for a while now, and we're just going to continue on that path. So we're going to improve our digital strategies, our communication strategies, and we want to understand our membership better all the time. So once we understand our membership better, we're able to service them better and provide them, engage them with them in a much better way.
Excellent. Now, Arnold, I want to just bring you in here on the topic of customers. What are your views regarding the size of the untapped market in South Africa?
Weza, there's a huge untapped market in South Africa. There's more than 18 million people in South Africa who have no access to private medical assistance. And the research has shown us that that is what they require. They need to be able to see a private medical practitioner to get the correct information from them. So what Unity Health has come up with is an affordable product that the people can use to see private medical practitioners.
And what do you think are the difficulties that we still need to overcome to reach these clients?
Well, I think one of the biggest difficulties obviously is affordability. People, as I just said, people need affordable health assistance, and most of them can't afford medical aid. And that's the beauty of Unity Health. We're an affordable product that people can use to get the required assistance.
I think let's take this moment to just have a look at some of the questions that we've been getting from you out there. And we're now going to get to ask some of your questions to our panel right here and just get to see what they had to say. So I got the first question here, and this one directed to Vernon. What does Unity Health cover in terms of COVID-19?
Yeah, thanks, Reza. So we've, as I said, we've put together a process to help members if they think they might be positive and to ask a bunch of questions. So we have our case managers that will speak to them and ask them a series of questions in terms of, whether they need to get tested or not. And if they do need to get tested, and if they do test positive, we'll pay for that positive test.
And here's the second question, Arnold. I think this one is for you. Now that you are a TV personality, because of last year's training videos, are we looking forward to any new training videos this year?
No, Veza, unfortunately not. We've decided just to have an interactive presentation that will be sent out to all the brokers. And then obviously the BCs will be doing their trips to go and see each broker and go through the product with them and answer any questions that they might have.
Well put, Arnold. Well, because of time, we couldn't answer everyone's questions, but fear not, because we will have our panelists over here, and of course, we'll also have Shivani, answer some of your questions in a podcast that we will release pretty soon, right after the launch. Other than this, you can also email us your questions as well on qa@unityhealth.co.za. Coming to the end of our launch, we did promise you that we would announce the recipients of those vouchers that we promised. 750 Rand Take-A-Lot vouchers are going to the following people. Just check the live chat right there, and if your name pops up, then be sure that our team will definitely be in contact with you via email to arrange that you can get your voucher and that you start using it as well. By the way, if you want to use your voucher, think of a boy. Come on, man. Okay. Other than this, Michael, is there anything else that you want to add?
Other than thank you for your time and everybody else's time, I think the most important thing from the rest of our team, and we probably all share the sentiments, is we'd like to see the back of COVID-19, and we look forward to the new normal in 2021. Unity is well placed to go forward in the future, and let's hopefully that we get there.
Oh, and one final thing, the brokers can access the broker training material as well as the accreditation test. In fact, even the repeat of this particular launch will also be made available to you. Well, with that, I'd like to thank each and every one of you, and also thank you, of course, to you too, Shivani, joining us all the way from Cape Town. It has certainly been a pleasure hosting each and every one of you and just picking your brains and just getting to learn so much more about the industry and just to know what 2021 is going to look like for Unity Health as well. I certainly feel a little bit wiser, and if I was a short man, I would be an inch taller. Thank you guys so much.
That was pretty good.